you.
Oh, I am so grateful, over the moon grateful for this opportunity. You are my people. My life was different and better because as a kid, long, long ago when I was a child, uh, after school folks made sure that I got what I needed to be healthy and protected. And you hold a very dear place in my heart. And so I will am excited to share that the other thing that has a dear place in my heart, and that's health insurance. And initially you're going to say, what kind of boring person cares about health insurance? Well, I only care about it because I know how much better our lives can be when we have access to good preventative primary health care. And the best way to get access to those services that make us better are is if we have a way to pay for it, and that's health insurance. So I have prepared some slides today to share with you. I echo exactly what was said earlier. This needs to be interactive. If you have a question like, wait a minute, I thought you just said, or anything like that, I absolutely welcome your comments. Please keep me in line and keep me relevant to you. So the organization that I work for is called Covering Kids and Families. And we, I believe, are the best kept, one of the best kept secrets in Indiana, because what we offer is health insurance navigation services to anyone in Indiana. It's we can do it in person, we can do it online, we can do it on the phone through an appointment. We have experts, we have people who have passed tests that are important to make sure that their expertise is high, and they've taken both the state test and a national test. So they're expert, but they're able to offer the services to you at no cost. There's no sales. We don't have anything that we can sell other than you having access to health care coverage. There's no pressure because no one's making money. Most times when insurance is involved, folks think, oh, there's gonna be a high pressure excuse me, comments made and make me try to do something that I may not want to do. That doesn't fit our model at all, because we don't get paid a commission or anything like that, not allowed to. And it's also private. It's not something that you have to go to a specific place to get enrolled. If you work with us, you don't have to go to the local Division of Family and Resource Office or anything like that. We can do it at your home, at McDonald's, at over the internet, or by phone. So today is all about health insurance. Who, what, when, where, why, and how. And I'm going to do my doggone best to give you all the answers to those. So what is health insurance? It's an agreement that's made with an insurer who pools the risk. That's the um, thing that makes an insurance, is this pooling of risk. And that company that pools the risk then pays for medical expenses incurred by the members in exchange for a premium payment. Excuse me. Now, there's two groups that do this pooling of risks. There's public players that you have already heard about. You've already heard about the Medicare program. You've already heard of Medicaid, and you've probably already heard of CHIP, which is the children's program. Then there's private poolers of the risk, and those are health maintenance organizations, or the PPO. You may have heard of that. It's a preferred provider organization, or a POS, which is point of service. There is no quiz afterwards, so you don't have to take notes or try to remember all of these things. I promise you, I'll keep it simple. So the things that I want to talk mostly about today are programs that are available through the state and or the federal government that offer health coverage to you and to those that you cherish. So you may be on this webinar and already have health insurance, but your neighbor, the people that you attend worship services with, family members, certainly the children that you serve and cherish may not have health insurance, and the information is relevant to whomever you cherish, and please ask questions if you have anything specifically that you need to know about. But in this divide between state and federal programs, the Indiana programs are called IHCPs, or Indiana Health Coverage Programs. And I continue to reiterate that throughout. So by the end of the webinar, you'll be like, okay, I know what an IHCP is. It's very often referred to as Medicaid, and that's okay, because Medicaid and traditional Medicaid is a part of this. There's a program called Who's Your Health Wise, the CHIP program, the Healthy Indiana Plan, which is called HIP, Who's Your Care Connect. And then these two down at the bottom are for folks who are already enrolled in Medicare. That's QMB and SLMB. I'm not going to dive into the programs that are more specialized for groups. I'm going to hit the ones that is most relevant to most of us, but want you to know, I want you all to know, is that our navigators and Covering Kids and Family staff have information and can get you enrolled in any of these programs, even if it's something you've never heard of before.
Susan Joe.
Oh, yes.
Sorry
Please.
to interrupt you. We have a few questions. I wondered,
Please.
are you ready? Okay.
Yeah.
So Sandra wants to know, are there similar resources for her staff members who live in Michigan but work in Indiana? So how, if folks live in a different state but work in Indiana?
Oh, I wish I could say yes to that. I hate the very first question I get, I have to say no. We can only serve folks that live in Indiana, and that's because our license are limited to Indiana. We do not have the ability to go outside of Indiana. I'm so sorry to say that. I absolutely know that there's organization in Michigan, though, it's not called Covering Kids and Family, though. I think it's called Cover Michigan. They dropped the kids and families. But if you Google navigator or assistance health insurance Michigan, I'm sure you'll be able to get connected to them. I'm sorry, I don't know the website off the top of my head.
Perfect, thank you. We have two other questions. One is, are the Indiana health coverage programs driven by household income?
Yes, ma'am. Somebody's read my slides. They are. I'm sorry, I think that's 6 more slides in, but absolutely, we're going to delve into income guidelines. So
Perfect.
Yes, they are.
Perfect. Thank you. And Michelle Davis, I see that you have your hand up. I'm going to give you the ability to unmute. If you still have a question, go ahead and unmute and ask your question, please. Okay, well, it might have been an accidental hand raise. Okay, so Michelle, if you do have a question, please go ahead and put your hand back up. All right, Susan Joe, back to you. Thank you.
Thank you. No, thank you. That was perfect. Please as they come in, just say, stop talking, and I will stop talking. The two federal programs that are most relevant and will affect most of the people on this call are the Marketplace, which you probably heard referred to as the Affordable Care Act or Obamacare. There's all kinds of names that it's gone by. And then I think probably everyone has heard of Medicare. So what is Medicaid? It's also called the Indiana Health Coverage Program. There, I told you I'm going to repeat this many times so that it's ingrained. So Medicaid is a public health insurance program for Americans with limited income and resources. It's a joint venture between the state and the feds. So the federal government organization that is in charge of Medicaid rules and regulations is called CMS, and the state organization that's in charge of rules and regulations and applications is called FSSA. I just want you to recognize those. If you see them, they're legit. So what are my friend, and I'm sorry, I forgot the name already, but my friend who says is program eligibility driven by income. Yes, it is. It's also driven by a few other eligibility factors. Age, So there's different programs that are available for people who are under 19 years old, and there are other different programs that are available on the other end of the spectrum, over 65. Income, and that's household income. Household is defined differently, of course it is, for every single program that is administered by FSSA. So if you think you, like if you're currently have a family member or a friend who is on the SNAP program, they think they know what their family income is. Guess what? It's a different definition of family from Medicaid. It's a different definition for other social services. So please don't get locked into thinking that you've seen one and you've seen one. I mean, you've seen one, you've seen them all. You've seen one, you've seen one. So it's like, you do have to be an Indiana resident. My Wolverine fan. Sorry, we're not able to help you if you're outside of Indiana. Your citizenship and immigration status is part of the application process, and it determines what program you may be eligible for. The diagnosis that you carry and or a health condition that you carry, or something that could have been, it didn't have to be, it didn't have to start at the beginning of your life. It could be a condition that you that happened to you because of an accident or wreck. But those diagnoses and health conditions also can determine which program you get into. And the bottom line is, if you have access to full coverage insurance, the state of Indiana is not going to give you Medicaid on top of that. They're going to make you file for your other benefits first.
Susan, Joe, we have a few more questions if
Please,
I can
honey,
go through
go.
those. Okay. So this is a very specific question. Janice might need to meet with a navigator to learn about this, but I want to make sure to ask it. What plans are best for 60 and over in great health?
Okay, you've been hanging out with me, Lakshmi, for too long now, because that's right, the navigator, that I am absolutely not the right person to be giving advice, especially about just a limited set of information, because it is so complicated. The process has so many levers that I may lead you wrong. So I am going to say we need to get you in touch with a navigator who will give you free, good advice.
And we'll be sure to, I mean, that contact information is throughout the
Oh,
slides,
it's,
and we'll
yeah,
we'll make sure
you're gonna
she
be
has.
tired of seeing my web
Okay.
my web address by the time we're done.
Okay. And then two more questions. India wonders, she says her husband and she currently have insurance, but their children don't qualify for their insurance and they get denied for Medicare state insurance. She's wondering whether the programs that you're talking about apply to her
Yes, ma'am.
or her family.
Yes, ma'am. I absolutely am going to tell you that you have got to meet with a navigator, because you don't want to leave your children uninsured. And it's the CHIP program is extremely generous. So I will get to the income guidelines in a few minutes so that she can judge herself, but I'm certain that she's going to qualify.
Okay, perfect. And then one last question from Scott at this time, and he's wondering, will an individual's health condition affect other staff's coverage costs?
No, thank you. Great question. In the olden days, pre-Affordable Care Act, the condition of the other folks actually did, in a group policy, it would hurt, I guess you'd say, or increase the cost of the program, that whatever they chose, whichever the employer chose. Now the Affordable Care Act makes it so that you can only answer three. I started to say two, I'm sorry, three questions that can be judged on: gender, zip code, and whether you smoke or not. Those are the only three conditions that matter. If you call gender a condition, I'm not sure if that's a condition or not, but smoking is considered a condition. And your zip code, which is behind my head there, in our state, unfortunately, we're not doing a very good job of taking care of Hoosiers, and our life expectancy based on zip code is much lower than our neighboring states and the nation as a whole. But those three questions are the only thing that matter. Thanks, Scott. Good question. Ready for me to go? Okay.
Yep, thank you.
Okay, no problem. This is perfect. I love the tone. So the traditional Medicaid programs, I guess you would say it was the Medicaid before the Affordable Care Act. They were designed to help folks who were aged, blind, or disabled. They were designed to help adults who were extremely poor. I mean, very, very poor, had little to no income. And they were also designed for children that had special circumstances in their lives or that were very poor. These programs are still in place, but there's been a lot of expansion of Medicaid because the Affordable Care Act gave permission to the states to expand to other populations. So here we go again. I told you you'd be tired of the word Medicaid, Indiana Health Coverage Program, but it's important. There's so much stigma attached to the word Medicaid, and folks think, oh, Medicaid, that's not for me. And the Affordable Care Act made that different. It is for us. It's for all of us. These are some of the programs that are you're most likely to see out there to try to help alleviate some of the stigma attached. So who's your health wise? See that cute little owl that's made out of the state's head. I mean, I guess it's his whole body, and the state is his body. The owl is for Who's Your Health Wise, and that's for children's program. Healthy Indiana Plan, with the I being the state of Indiana, is for adults. Who's Your Care Connect, again, the I is part of the I in the word Hoosier. That is a program for folks who have special healthcare needs and may traditionally be called disabled or differently abled. And then just plain traditional Medicaid is still a program as well. So if you hear Medicaid, I hope after this you will also hear IHCP in your mind and say, that crazy lady told me that Medicaid isn't always referred to as Medicaid anymore. It's called something else, and it's not just for the blind, aged, and disabled or extremely poor. So just to prove my point, there are over 2 million people that are on a Medicaid program in this state now. So you see the Healthy Indiana Plan. You see how many folks are on that. You see how many are on Who's Your Health Wise and Who's Your Care Connect. Those are the ones that I just referred to you. Over 2 million people. Okay, poll question. How many residents in Indiana do we have? Tell me, Lynn.
Somebody raised their hand. People
know,
are ready.
What is it? What's the answer?
Lynn, what do you think?
Do I think about
How many people live in Indiana? Oh, you weren't answering the question. You have a question.
Oh, okay.
Do you have a question, Lynn?
No, I'm sorry. I
Nope.
misunderstood, so I'm gonna go.
Okay. Well, thanks for being here. Okay. India, do you know how many people live in Indiana?
I don't. I was referring to myself because I live in Indiana. I'm sorry.
Oh,
no,
I misunderstood the
you know
question
what? We're
too.
glad you're here. Thank you. And you do live in Indiana. I actually heard Speaker of the House Indiana General Assembly speak this morning, and he said we're almost at 7 million.
6.7 million, exactly. 6.7 million. Okay, do the math there, guys. We have about 2.4 million folks on Medicaid as of today, and 6.7 people live in Indiana. You know several people in your life that are on a Medicaid program. When 1 out of 3 of the people in Indiana are on one of these programs, that's a lot. That's a big deal. And we have got to protect them and keep these programs going strong. But so don't assume that it's just someone that lives in a different neighborhood or goes to a different social gathering than you do. 1 in 3 Hoosiers are on these programs. So this is like a summary for just to wet your whistle on where we're going the rest of this call. children in Indiana usually can sign up for, their parents sign them up, of course, for Who's Your Health Wise. That's up to 250% of the federal poverty level. I'll have the exact number in just a moment for you. But for a family of four, that's a family of four making about $70,000 a year. Their kids would qualify for Who's Your Health Wise. For the Healthy Indiana plan, same family, much lower income threshold for adults. It's 133% of the FPL. So that same family of four, a parent or an adult in the family can only get on HIP if the income is below 38,000. Marketplace, Obamacare, Affordable Care Act, whatever goes off in your head when you hear Marketplace. That program has lots of subsidies and lots of help. So a family of four, same family of four, can be making well over $100,000 a year and still get Marketplace coverage. Just a small little note down here in the adults category, when a person becomes pregnant and is in that household, the household counts the unborn child. And so the income guidelines go up for a higher number of people, and pregnant people also have a higher level. The income slides up to 227, I think it is. That's the reason you have to have a navigator help you get through all these numbers, because there's no way that any of us can remember all these numbers off the top of our head. But at least that gives you the general thought. I bet there's some people on the call that didn't know that they could get free or very reduced costs, less than $5 a month insurance with a family of four making over $100,000. I bet there's not people. I bet that's a surprise to some of you. So
Sandra, we do have a few questions.
okay. How
yeah,
come I can't see the questions? Because you're in charge.
I don't know.
Okay.
Maybe because you are focusing on your slides and
There you go.
I don't know. Maybe it's because I'm the host. I do wonder, if you didn't know that about the, information Susan Joe just shared. I mean, if you want to, why don't you throw up a reaction, give us a thumbs up or something, so we can see how many folks are. Yeah, we're surprised to learn that. We do have a few questions. Oh, thanks. I like to see those little floating hands. Wow,
It's totally
that's cute.
cool. Totally.
Anyway, Sandra wants to know, she says she previously heard that HIP was full and not taking any new enrollees. Is that correct?
Not at all. And I'm so sorry that you heard that. Literally, you have just made my day by saying that out loud, because I get to dispel a myth today. So I literally, my work here is done. I'm going to hang up. No, I'm kidding. But I'm extremely happy that you said that, because that was true when HIP first started. And that was, I'm sorry, I don't remember the year. I should know that off the top of my head, but I don't. 10 years ago, whatever that is. 20. Yeah, I think it was 2012 or 2013. I'm sorry, I don't remember the year. But initially, when it was just, I'm going to say a practice run, when the CMS had not given the state permission to do anything more than a demonstration project. That's what HIP started as. And my old boss wrote it, I'm so proud to say. And there was a limit of 40,000 people. Now, if you're eligible, you qualify.
Wonderful. And Margaret wants to know just about more information on the marketplace.
It's coming, honey. Hold on.
It's coming. Okay. And we have someone from Noah's Ark Daycare who asks, I was on Marketplace Insurance last year and they signed up this year, but the care source system still doesn't show them in the system. They don't qualify for Medicaid, HIP, other insurance.
Don't tell me any more personal identifiable information. I don't want to know any more of that, just because I don't want to make a mistake and tell you wrong stuff.
Okay.
He or she is got to talk to a navigator. We have inroads with all of the managed care programs. Actually, the president of each of the insurance companies that serve in Indiana are on our board of directors. So and they financially support us. So, it's in their best interest that we know as much as we can and get as much information about for our clients to them so that they deliver good services. So I can promise you, I have a navigator for you, sister. We will definitely get that problem answered, but I'm going to have to make the referral. You'll see it in a little bit. The
Okay,
number you can call.
wonderful. Someone who's on the phone was wondering, do you have numbers for households of 2?
I will in a minute.
Okay, perfect.
Mhm.
And this is more of a comment. I wonder if you might be able to share your thoughts on this. That the idea of affordable on the marketplace, this person felt was not affordable for
Okay.
her in any
Um,
shape.
Okay, I don't know when the last time was that they were on the marketplace, but the Biden administration made some fairly hefty investments into the Affordable Care Act and on the national level. Now, I don't necessarily have state specific information yet because marketplace just closed. So I'm sorry, I don't know yet. We just don't have the data. But on a national level, 90% of the people are spending less than $10 a month for full silver package coverage.
Okay.
So
And
that was affordable to me.
okay. Wonderful. And then we have a question from Eugene wondering, is there a possibility that enrollment could cease for any of these programs?
I love that question. So I started doing this work in 1991. Most of you were not even alive. And I never thought we would ever see Medicaid be expanded to the level that it is now. So the Affordable Care Act happening and now states being able to expand these benefits, it is like water running down the hill because there's so many folks enrolled. I cannot imagine that there's a political will for it to go away. And I've been surprised before. So, let's not think that, but most of you can identify with Medicare and what you've just heard on the news the last couple of days. What was it yesterday? I'm sorry, I can't keep track of my days, whenever the State of the Union was, but they've been talking about is Medicare on the chopping block. And there's not a politician who is Republican, Democrat, independent, socialist, anywhere on the spectrum who will ever touch Medicare, because the people who are on Medicare vote and vote in mass and that's their entitlement. And I just know that that it would take a massive revolution for us to lose Medicare. And I think that Medicaid falls close behind that.
Okay. We actually have a lot of questions here that are open.
Holy
So
mackerel. Do you
yes, it's
think that
wonderful.
could I push through the slides and see if some of the questions may
Yeah.
be answered in the slide? Could I do that?
Yeah.
Just a couple.
I some of these questions I do know you're going to get to. So yeah,
Okay.
let's go ahead and
Okay.
do that. Thanks.
Hold on, y'all. I'm going to talk faster. Okay. So, what you need to know though is another thing that the Affordable Care Act did that was great was that it made the rung that lifted the bar, let's say, high, so that plans on the marketplace had to be good, solid plans. They couldn't just be like before the Affordable Care Act, we would often have like a cancer program so that you could buy insurance if you got cancer. But what if you got something else? What if you were in a car wreck? Well, that insurance didn't cover that. That's not good insurance. So one of the cool things about the ACA are these 10 essential health benefits, and you can read through them there. I numbered them, but I just want you to know that this is just about everything that you would ever need that could happen to you or your family. Outpatient services, emergency room, inpatient services, pregnancy, any of the mental or behavioral health treatments and substance use disorders. It moved us into parity that your head and my heart are attached to my body. And so if I'm having an issue with substance use disorder, that gets as much attention and gets the same kind of treatment as if I had diabetes. Oh, I do have diabetes. Prescription drugs, rehab services, labs, all the preventative wellness and chronic disease management. Most of the preventative comes in at free, and all of the wellness and chronic disease must be extremely free, extremely cheap. And then pediatric services have to be included. So who is paying for all of this? If an employer has more than 50 full-time equivalent employees, they must offer health insurance to their employees. Individuals always end up having some piece of this cost sharing pie. Here's some words that you will hear when you're talking about health insurance. We went over premium already. That's the amount we pay to engage with an insurer. A deductible, a co-payment, co-insurance, max mile covered. This is the reason that you want to have a navigator with you so that you don't have to memorize all of these definitions. But I do have some of them here just for you. That there's deductibles is the amount of the money that the individual has to spend before the insurance picks up the tab. Co-payments, that's a fixed payment that's made every time you go to that level of service. Co-insurance is a way that unfortunately sometimes you end up paying more than you thought you were going to have to, because your employer has taken on a program that has a high co-insurance rate. And then the out-of-pocket maximums, that's the thing that you want to make sure that you spend early in the program or early in the year, so that by the end of the year you are not you're not having to pay anything more. Again, don't ever delay until the next year, because you'll have to pay your deductible again. Sorry, when I try to talk fast, that's what happens. I'm sorry. All of y'all that wanted to know the numbers. Okay, you're probably gonna have to stare in at your screen. I'm sorry. I just want to share this with you, though, to sort of warm you up to knowing that there is assistance for folks, regardless which color of column you fit into. So as you see there, the yellow, if you count down how many people are in your household, go over to your income. If you fall in a yellow category, you're going to qualify for an Indiana health coverage program. If you fall in the blue category there, that means you're going to get a tax subsidy, which will most likely drive your costs for a marketplace plan to less than $10. And then if you're in the whatever, I don't know what color that is. I picked brown, but it's not really brown, whatever, sort of a ugly pink color. If you fit in that group, then you are eligible for subsidies, but they will not be as good for you as if you were in the blue column. They won't be as lucrative. Everybody got a chance to look at that so far? Did that help answer any of the questions? Yeah, can't tell.
Yep,
Did
we
you?
got some thumbs up in the reaction. So yep,
Oh, good.
lots of them.
Oh, good. Thank you. Let me go a couple more slides in, then we'll take more questions. Okay. Early, very beginning slide, I said who, what, where, why, when. So this is the when answer. Okay. You can't always just enroll for health insurance. If you're applying for an Indiana health coverage program or Medicaid, you can any day, anytime, anyway. But if you're using the marketplace, or if you are getting health insurance through your employer, they limit the amount of time that you can enroll. You have to enroll during open enrollment period. Now, the marketplace has special enrollment periods, which we'll get into in just a minute. you have to file an application, and there's very many special circumstances where you can get in and get enrolled with a waiver. But these are the most likely times that you would, during open enrollment or during a special enrollment period, is when you would enroll. Okay, this is what I gotta tell you. See how our growth in Medicaid has happened just since the public health emergency? One of the reasons that happened was because the federal government told all the states during the public health emergency, you cannot disenroll anyone from health insurance. That was to protect us, if not just COVID, but if we got anything or our life changed and we had a change in our physical health as well, we wouldn't go without health insurance. There are some people that are on the Medicaid program right now who have moved out of state. There are people in this program who have passed. There are, clearly they're not incurring bills, so they're not costing us anything, but they still have eligibility. The public health emergency has been uncoupled from this continuous enrollment order from the federal government. And now, starting in April, folks are going to start hearing from the state about their Medicaid enrollment. And remember early on, I told you guys that we all know people that are on Medicaid. We just don't realize it, but there's 1 in 3 Hoosiers on Medicaid. This is the information that I need you to help get to them, is that the continuous enrollment is ending, and they will be reviewed for eligibility. For those of you who have not yet applied, do it before April, because what will happen is you will get on during the old rules and more likely be able to stay on until February, March of the next year. So, excuse me, don't delay applying. Here's the rollout. I know this has got lots of words on it, but basically, if you could just hear me say, don't delay. If you're currently on Medicaid or know people who are, make sure that they're told the state, either through the online portal or a call or whatever way they can get there. Make sure the state knows how to get in touch with them so that they don't fall off the program because they did not comply with the requirements. The estimation is that 75% of the people currently on Medicaid will stay on Medicaid, but the extra 25% are subject to getting rolled off Medicaid. Same thing that happened on the state level with the Medicaid program happened on the federal level with the marketplace. The marketplace enrollment could not be stopped during the public health emergency and the continuous enrollment. That's over now too. So there will be folks who will lose their Medicaid coverage, but will now qualify for the I don't want to say Obamacare because I don't like calling it like that, but that's what some people call it, the Obamacare, the Marketplace, Affordable Care Act, insurance, whatever feels comfortable in your vocabulary. The federal government has waived the end of the enrollment period to make a special enrollment period. That's what SEP stands for. So that folks will be able to roll into and get on Marketplace until July 31st of 2024. Clear as mud, right? No, it's not. And I told our sponsor today that I'm not going to share slides for the first time in my career, because these parts and pieces of the rollout are moving. And I don't want you to rely on something that is true today that may not be true in April or God forbid July. Okay, so maybe she'll invite me back. I don't know. We'll figure out a way to get back. To keep up on each other on this information. But there is stuff going on out there to protect this for even longer periods of time. But I don't want to make those promises because that's all just a discussion now at both the state and the federal level. So I'm going to say that I'm at a place where we can answer questions again. If you want.
Wonderful. Yeah, we have quite a few.
Okay.
And then I hear what you're saying on the slides and how, things are in the works. So maybe some of those dates might change, but if folks get in touch with the navigator,
Oh, yeah.
then the navigators will be able to tell them
Absolutely.
accurate information. Okay, so there were quite a few questions about getting enrolled in the marketplace and that open enrollment period. And I think that you've addressed those questions. If you asked a question about the time frame for enrolling in the marketplace and you still have questions, can you go ahead and write a new question or let us know in the Q&A that you still need that question answered. Okay, let me see. It does look like we've answered. One person is wondering about how to go about getting a policy for their business with under 15 employees.
Wow, you're a good person. First of all, there's a special place for you in heaven because you're doing something that you're not required to do, and that makes you extremely popular in my heart. You will definitely want to use a broker. You will want someone to do the negotiations for you. So I don't know where everyone's calling from. You're somewhere in Indiana, I assume. Find a trusted broker in your area and tell them what you want to do. Say, I want to get employee-sponsored insurance. Can you start the negotiations for me? And it is, I'm a lawyer by training, but it's a icky place in law. I mean, I don't want to do that. That's why I'm saying that you need to get a really, really, really good agent to make sure that you can trust them and make sure that, brokers, what I meant to say, that you can trust them and also be ensured that you're not going to run afoul of any of the legal requirements.
Let's see, there are 15 questions on this list, although I do
Holy
think you've
mackerel,
answered.
you guys.
That's wonderful.
My
Wonderful.
best ever.
You have answered some already, so there's probably maybe 10 we need to talk through.
Okay.
I'm not sure if you'll be able to answer this question, but I want to ask it anyway. Someone is asking, if I want to help pay for staff health care, how can I do this not as taxable income? So it won't be taxable income,
Ooh.
I'm assuming, for the employee.
Exactly. Okay, that's your accountant's question, because this is health insurance is still mandated, believe it or not. It's just not enforced through the tax code because it's a tax law. The Affordable Care Act is actually a tax law, and the mandate came through that every individual in the state that files taxes has to have health insurance. That's still true, but the penalty is $0. So no one is taking it seriously, right? So that is not a trusted broker and a trusted accountant. If you can get both in the same, that would be the best way to do it. And I would absolutely encourage you to work with a navigator in your area too, so that folks who do qualify for these other programs, you aren't taking on financial ownership of something that you wouldn't have to pay for.
Okay.
That's advice. That is not counsel. I came out as a lawyer. I need to say I'm not a member of the Indiana Bar. Anything I say is not considered legal advice.
Gotcha. Thank you. Okay, let's see here. A question about wait time. So Joyce is saying that, she needs to get insurance and she applied, but they're telling her that she needs to wait 45 days.
Oh, something's the matter. That's not good. I don't know, I can't even imagine what it is. So let's get in touch with a navigator, help walk you through that, because they can unblock the log jam sometimes.
Okay, wonderful. You talked about 50 full-time or 50 employees. Um, if we have 100 part-time employees, does that count as 50
Okay.
full-time? Is it full-time equivalents or actual 50
The
humans?
law says 50 full-time equivalents. And I'm not a member of the Indiana Bar, and I can't give you legal advice on that. Definitely make sure that usually the accountant that you're using knows that law, because it comes up in your filing of taxes. So
Okay, wonderful.
make sure you get good advice on that.
Okay.
Don't go to federal prison. Not a pretty place.
This is a question for the accountant, not the navigator, right?
Yeah,
Okay.
yeah.
So, okay, talk to us about the quality of care. Someone's asking that they've heard healthcare professionals state that they will not provide the same quality of care for someone on the marketplace versus someone on private pay insurance. Have you heard that before? Is it true?
It's immoral and illegal. And if they get caught doing that, they will lose their license to practice medicine. So, or whatever their license is. I'm licensed as a clinical social worker, and I can accept Medicaid and private practice insurance. And part of my agreement as a provider of those things is that if I am found guilty of giving different levels of care, I will lose my license. Every licensed healthcare professional has that same obligation. And yeah, if we hear about it, it's the same as if it were age discrimination, race discrimination. It is a form of discrimination. So it is absolutely illegal and immoral.
Okay. I'm wondering, sorry, somebody is asking about, wait, I'm sorry. How do you feel about the shop marketplace?
I think it's complicated. I think it's hard to, I started to say hard to navigate. I don't want to use that word. I was trying to think of a better word. I think it's hard for employers to navigate it. And I would literally say that it's worth the money you would spend on a trusted broker than trying to go through shop to get your health insurance for your employees. That's
Okay.
my opinion.
Question from Corey about don't the different tiers of the health plans in the marketplace, such as bronze, silver, or gold, dictate your co-payment, specialist visit, drug cost, and so forth?
Above. So if you want to drive nobody drives a Cadillac anymore. If you want to drive a Lexus and you pay for a Lexus, the bells and whistles will be different. So if you get a gold plan, yes, they will be different. But the minimum, those 10 essential benefits that I talked about several slides back, those don't move. So no, it doesn't dictate the treatments, I guess you could say, or the specialists that you could say. No, all of those things are still covered as essential health benefits. But your negotiation with an insurance company decides on if you're going to pay $10 per copay or if you're going to pay $20. I mean, yes, that definitely changes.
And you talked a little bit about enrollment times for the marketplace or different things. But if somebody has a job change or a change in their family circumstance,
automatically a special enrollment period, no questions asked.
okay, there were a few questions about that, a change happening down the road. And then, there are quite a few questions. I know we just have a few minutes left of this about, is there a cost for working with a navigator? How do we get a hold of a navigator? And so I wonder
Yes.
if,
May I go to the next slide?
Yep.
Okay, so you can schedule an appointment on the scheduler. So this is ways that you can give this information to. I'm going to make sure you have this slide too to send out. Okay. Okay. That you can do it online. or on your phone, which is what everyone prefers to do. No one wants to make phone calls anymore. Or you can go to the website, which is here. When you go to the website, open up, talk to a navigator, and there's a screen that shows the whole state of Indiana. You touch on the county that you're in. Excuse me, and you'll be taken to the schedule. I don't know what happened. Excuse me. It sounds like I'm going through puberty. Oh my gosh. So you will be connected to a navigator in your area, or you can call 1-888-975-4CKF. And when you do that, it'll say, what county do you live in? You spell the first 4 letters, I think, of your county. And then it will literally connect you to the phone of the person that is in that county as a navigator. So that's the way that I would like you to do it. It's because it's easier. It's just easier. But if you want to go to one of those agencies that is on this slide here, you can also walk in and go to one of those agencies. I will absolutely make sure that you have all of the ways to contact us in the packet that's sent out.
And you didn't talk about this, but from talking to you separately, I know that like your navigators could go into an employer in a place of employment, like they could go into one of the child care centers.
Absolutely.
Can you
That-
share a little bit more about how that would work?
Absolutely. We would love it. Let me not be such a shameless plug there. So we would love it if you would say, hey, come on Thursday. I'm making this up. Thursday afternoon at 2:00, and all of the employees here will have a break that they could meet with the employer. With the navigator. Or let's have you come in Tuesday morning and stay until you get through everyone. Literally, whatever you ask for, we are pretty much able to do. We have folks that will come on site. We will come to any event that you have. If you have, I don't know, a special parents' day or donuts with dad and martinis with moms and all those different things. Maybe it's not martinis. I'm sorry, I might not have gotten that right. But whatever program you have like that, we would love to come with a table and lots of cute little giveaways, and make it so that they can come and go as they please and talk to one of the navigators, ask their specific questions, or say, hey, I don't really want to talk about this in front of everyone. Can I have your card? And then you set up a private appointment with them. Those folks are available to come to your space before work hours, after work hours, during work hours, obviously, or weekends and evenings too. All of our navigators are not 8 to 5 Monday through Friday employees. They are flexible employees. Is there anything else I can think of? But it's actually a really popular thing that small businesses like to do, is that, let's get this over and done with and just have you come in and go through everyone, or set it up every month. We come every first Tuesday and we just come, and if there's been new hires or actually even families that you're serving that might want to meet with a navigator, you're given the space for them to do that in a private and wholesome way. We'd be more than happy to do that with any of you.
Wonderful. Okay. Well, we are at time. It's 12 noon. I want to thank you, Susan. Joe, if you want to, thank you so much for your time and being here today, and sharing all this wonderful information. We had a ton of great questions, and I'm sure folks still have questions. They'll think of something after this. So definitely getting in touch with a navigator is a great way to get your questions answered. Visiting the Covering Kids and Families website is another great way to get questions answered, or to get in touch and have someone from CKF or one of their navigator partners to come to your place of employment.
Absolutely.
To help. So,
and if you put a question in the website, ask a question, those all come to me. So I'll get them to the right. I'm not going to say that if there's 157 questions, I can't answer all those. I will send them to the navigators throughout the state, but we will definitely get your questions answered, I promise.